Again, my name is Dylan Simon, and I'm here to talk to you about newborn screening and newborn screening policy. So we've heard a lot today about the problems with newborn screening, and it really is generally considered one of the most successful public health programs in the country, but it's not without its challenges. And so today I want to talk a little bit about some of those policy areas that we can look at to potentially improve newborn screening, while also acknowledging some potential avenues to do that. So here you can see some of the challenges within the newborn screening system, but the part I want to highlight is the part you see on the right side of the screen, which is in a 2021 study from RTI International. When surveying a wide variety of newborn screening experts, 100% said changes were needed to meet the system, and that newborn screening system was not addressing all the current challenges that it was facing at the moment. And within that 100%, 45% said they needed a large change. So 100% said some change was needed, and at least almost half were like, we need to really be thinking about large-scale changes. And so that's what has really led the community over the last few years to really have some larger conversations about how can we ensure the fact that the system is growing and moving forward to address the challenges that it's going to face in the 21st century. So that's what led to a group of organizations that you see on the right side of your screen to come together and bring the community together as a whole to begin to address some of these challenges. We wanted to make sure that we were bringing together the entire community, not just patient advocacy organizations, not just industry, not just state lab directors, but everyone together talking as a collective amongst each other, including state lab directors, federal officials, academic researchers, to make sure that we were approaching the challenges from all perspectives. I'll talk a little bit about that when we get into the final theme. This idea of making sure that we weren't proposing policy solutions that could not be implemented, because the key part we've heard today is actionable policy solutions. How do we ensure the fact that what we're talking about can actually get done? And so the planning committee brought together the roundtables, which consisted of 3 events, the first of which was a public event, because we wanted to make sure we were hearing from the entire community. And then we brought in, for the final 2 events, a bit smaller, but again, wanted to make sure we were engaging the entire landscape, so patient advocacy organizations, state lab directors, industry, as well as federal officials, academic officials, and other state officials, to make sure that when we were talking about the solutions, we heard all points of view. And so we really came into 4 key themes, and so I'll walk quickly through them now. I also want to highlight we had released this white paper last week, so a full understanding of all the policy solutions you can find online. And so today I'll focus mostly on the themes themselves. And so you can see here with theme 1, it really looks at the federal government. And this idea that federal agencies play such an important role in connecting the newborn screening ecosystem and must increase their leadership within the newborn screening space to support the states in their work in adding conditions, as well as ensure the fact that we can meet the innovation landscape where it is, ensure the fact that as the science and diagnostics and treatments available that can impact newborn screening, that the program itself can support that growth. And so you also see on these slides some of the selected proposals, solutions that included within the white paper. I won't dive too much into those today, but again, in the full white paper, you can find that online. And the second theme was looking at regional lab networks. We talk a lot about the fact that newborn screening is a state program, and at the end of the day, states are the ones who are conducting these screenings, conducting the follow-up, and we need to make sure that they're leveraging that expertise with each other. So the creation of a regional lab network has been discussed. That was an accepted fact within these roundtables, that we need this collection of labs that are interacting with various states across the country and determining how best to leverage that expertise in terms of conducting additional pilot studies, ensuring the fact that we have potentially one lab focusing on how best to implement a certain condition, and ensure the fact that we are adding them as quickly as possible. So the next theme we're talking about is increased access to public data. And so within the newborn screening community, there's a lot of data to be collected around false positives, false negatives, the impact of newborn screening on families, and ensuring the fact that not only are we collecting a uniform version of that data, but that it's publicly accessible. And so there's some work that's beginning within CDC with the Eating Project, which does a lot of this, so I encourage people to read more on that. But it would really build on that and ensure the fact that it is going nationwide. And lastly, I want to talk about theme 4. This idea of integrating genetic testing within newborn screening. I had said before in terms of the importance of making sure we had multiple perspectives. Within this theme, when talking about it quite frequently, we had state lab directors who said, we would love to do more of this. We think this can dramatically improve newborn screening. We just don't have the capability. And so you can say, add genetic testing all you want to the screening process. We just can't do it. And so this idea of ensuring the fact that when we're talking about integrating genetic testing into the newborn screening system, that we're doing it in a way that is a value add, that will truly improve the system and ensure the fact that we're not creating new disparities across state lines if one state can add genetic testing to their newborn screening program and another cannot. And so I know I have moved quickly through the 4 themes, but in terms of where do we go from here, I think it's important to note a few things. First, the challenges we talked about today are not the only challenges of the newborn screening system. There are workforce challenges that impact the entire healthcare system that also impacts the newborn screening system. There are challenges within the follow-up system in terms of inequities and the ability to contact these families. There are challenges within the pilot studies themselves and the ability to fund and start up these programs. So we were not conducting the roundtables to solve all the challenges of the newborn screening. We wanted to start the idea of, like, here's a place for us to start. Because as you can see from here, it's been a long 20 years within the newborn screening space. 2003 was the first time we saw a published genome. 2008 was the first passage of the Newborn Screening Saves Lives Act. And after the last reauthorization in 24 is when we saw the first FDA approval of a cell or gene therapy, which we know can drastically change the newborn screening system and the amount of conditions that will utilize newborn screening as a diagnostic route. And so where we go from here is continue to work on the current reauthorization, because as you can see on the bottom of your screen, the current Newborn Screening Saves Lives reauthorization has remained unauthorized. And so we want to continue to work towards that passage, as well as begin a conversation of what additional policies are needed to ensure that newborn screening can continue to grow and continue to remain one of the most successful public health programs in this country. Thank you so much for your time, and I'll pass it.